My name is Tanisha Al Salhuddin, and I want to say no struggling and wondering over here. This morning, I'm going to talk to you about bee stings and the holistic value of bee stings. Many people nowadays are going and getting bee stings to heal all sorts of sickness and disease out of their body, from fibromyalgia to rheumatoid arthritis to even HIV/AIDS to cancer and other sicknesses. Understand when the more sick you are from sickness and disease, or even arthritis, it being in your joints and your bones, the worse of reaction you get from the bee sting. And that usually scares people the first time they get stung by a bee because they really don't know why in the world their body is having such a bad reaction. They call it a allergic reaction to the bee sting. In actuality, it may be their body pushing out the poison or sickness from whatever illness or element they may be suffering from. It's a different reaction versus maybe being allergic to a fish or some type of meat or something else, where that may be actually poisoning your body versus making you well. Now, the bee sting can be administered at a hospital, it can be administered at a clinic or a holistic well center, as long as you have trained professionals there who have CPR certifications, who are trained on maybe administering an IV or trained on giving an EpiPen injection. If you do it at a hospital, you have access to the hospital if the patient reacts in such a way where they may have to be incubated, or they may have to go have breathing treatments, or they may swell up so bad their eyes may swell shut, close shut. But understand, even though the patient goes through that stage of having a reaction to the bee sting, pulling out the sickness and poison and toxin in their body, they have to keep pushing and go through the second stage of getting another bee sting to actually rid them of any sickness and disease. So, how do you go about going through the second stage of sickness and getting rid of sickness and disease? Excuse me. You have to let the patient go through the first stage with the bee sting. If they have a reaction to where they feel swollen and they can't breathe, you administer the EpiPen, and that helps them alleviate some of the feeling of having a reaction. But you don't stop there. You do it again the second time with the bee sting. You give, if the second time, usually the reaction is not so bad, it's not as harsh as the first time. So the second time you administer the bee stings, and you may notice the patient may swell or may have reaction, but it may not be as bad. It may be sort of subtle. Then you do it again, a third time. And when you do it this time, you may see the patient may barely even have any reaction to it because their body's getting immune to it and their body has pushed out a lot of the sickness and disease. Then you do it a fourth time, or until keep doing it until they have no reaction, and you see the patient talking about weeks or months later having alleviation of sickness and disease, maybe arthritic pain going away. Because in the joints with arthritis, you have sickness and disease in the joints, which causes the rheumatoid arthritis or the arthritis. So you may hear of the patient saying their fibromyalgia went away, their fascia myophagia might have went away, their TMJ might have went away, their you may not hear them, patients with AIDS say they don't have any more sickness or they don't have any more problems, or you may hear of patients with cancer saying they've been not having any sickness or problems. But the thing about bee stings is you have to administer the bee stings and get past that stage of them having reaction to where they have no reaction and they just are feeling well. And that way you can set them up on a time schedule for the bee stings to be administered at the hospital, at the clinics, or at a holistic health practitioner's office where they can get a bee sting maybe every 3 months or every 6 months to that way where they can build up their immunity to the bee stings, where disease and sickness can't live inside their system. Um, I want to also say that when you do it at the hospital, it's the first part of the first stage when they're starting to have the reactions. Then you move them down to maybe a clinic setting or a clinical setting. Then you do a holistic wellness setting where you can administer the bee stings, or even go out to a bee farm or a bee ranch where they can get the bee stings. And that's how you want to go about doing the bee stings. The bees push out sickness and disease, and that's why you want to administer bee stings. It helps the body get rid of sickness and disease and alleviates pain, illness, and other types of bacteria. Okay, thank you. My name is Tanisha Al Salhuddin. Have a good day.